growing issue in England and Wales. And I'm going to give you a kind of background to the study. You, as local authorities, play a key role in identifying and supporting survivors and in preventing this scourge from taking place. However, we know that many local authorities face challenges in fully adopting their legal responsibilities as first responders. I'm sure we're going to be talking about those more today. Now, the Anti-Trafficking Monitoring Group first alerted us as a team of Middlesex University academics to the problems of weaknesses that exist with existing first responder support. So, for example, there were issues getting onto the national referral mechanism from existing first responders. I'm talking about non-local authorities. So, for instance, geographic coverage was weak in certain regions, distrust of certain official first responders like the Home Office or police from survivors themselves, resource constraints for charitable organisations who are first responders. And the idea was that in many ways, local authorities fill these insufficiencies. So, for instance, you cover every inch of the country, you're relatively well trusted. And whilst we know that you are being financially squeezed at the moment, and by the way, I'm also a local councillor myself, so I've got two hats on here, you are better resourced than first responder charities. Further, with your responsibilities for housing, social care, education, and safeguarding, these are the very areas where modern slavery often occurs and survivors often seek help through. But what we needed was a greater understanding of what your own challenges and opportunities were in terms of fulfilling this role. So the report that we published explores these. It focuses on a kind of training needs analysis to bridge the gap between current levels of first responder awareness and how collaborations in communities of practice can work to strengthen the local response to modern slavery from local authorities. And I'm sure most of you have read the report, but one of the key findings was that we found that frontline staff may lack the necessary training and awareness to recognise, for example, cases of exploitation and to respond effectively. And whilst the Modern Slavery Act 2015 sets out clear legal obligations for yourselves to do all of these things, sometimes limited resources, inconsistent training and gaps in interagency collaboration mean that there's a bit of a struggle there. So ultimately, in terms of the study aims, we want our report to have real-world impact. That is to say, to assist yourselves to improve your response as first responders in the prevention, identification and provision of support to modern slavery survivors. And of course, there is an absence of an existing national training framework that is scalable and can easily be adopted to help build capacity. And this is what we're trying to construct here. But in order to do this, we needed to look at your current experiences and first responder capacities in terms of meeting modern slavery obligations. So the intended impact, the project itself, this is kind of a little bit theoretical, so I won't spend too long on this, but it's rooted in the concept of social accountability. And the idea is that engagement with stakeholders on a continuous and long-term basis is essential if meaningful and sustained change is to take place. And this is what we hope that we'll be able to support you with. The training framework that we are constructing with yourselves is implicitly helping us to recognise that local authorities can't necessarily always fulfil their legal or moral responsibilities without building and maintaining open, iterative forms of dialogue and feedback with those affected by and working on modern slavery. And you can see here there's kind of three pillars to achieving this, and they move from one another, and they're underpinned by the concepts of socialising accountability through collaboration, dialogue, shared responsibility and intelligent accountability. Intelligent accountability is the second precept. So concepts of continuous learning and feedback loops as well. So we don't just simply stop here with the training framework. We want to consult you on it, and then we'll continue to adjust it over time. And in that sense, the training framework isn't just about content or delivery, but generally about helping you to embed mechanisms for ongoing accountability and responsiveness. Could you put the slide forward for me, please, Eric? I'm struggling to do it. Have you done it?
You have control done.
Oh, okay. I can't seem to put it forward. Okay, great. All right. So just a final slide for me and before I hand over to colleagues. So look, our research was conducted sequentially in 3 phases between 2023 and 2024. The origins of the research date back longer than that, but the primary research was carried out in the last 2 or 3 years. It commenced with a document analysis of modern slavery statements from 48 randomly selected local authorities. And our focus was on examining the kinds of training that they seek to conduct, the delivery methods, who within their authority should be trained, and which organisations are collaborated with. We then distributed an anonymised online survey, which targeted all 339 councils in England and Wales. We received 36 responses. They were completed by the designated modern slavery lead, or if there wasn't one, then it was the most senior individual with responsibility for related areas such as community safety. And these sought their organisational awareness of modern slavery and their employees, managers, local councillors and contractors' roles as a first responder. And we also explored training coverage, frequency and enforcement, and how local authorities collaborate with external bodies. And we triangulated the survey findings with the modern slavery statement analysis to identify areas of fulfilment and discrepancy. And finally, we concluded with semi-structured, in-depth interviews with 15 modern slavery leads and coordinators who were tremendously helpful to us to help deepen our understanding and analysis of these areas through a deep dive into many of these issues with those who, like yourselves, help oversee the identification and prevention of modern slavery. And finally, at each stage, our research sample included cross-sections of authority, so from different tiers, district, county, unitary, combined authorities, different political leaderships, different sizes, whether they were rurally or urban dominant, and so on. And then I'll pass on to my colleague now.
Okay, wonderful. Thank you very much, Dan, and hello, everyone. So I'm going to present our findings for each of the 3 phases. First and foremost, we started our research by concentrating on modern slavery statements that local authorities had reported. He randomly selected 48 local authorities, and of these, 52% had modern slavery statements reported on annual basis. And out of these, about 40% reported some form of information about their training programs and their collaboration with other stakeholders. And only a very small percentage, around about 10%, reported about training their suppliers, and even a smaller number did identify which suppliers had modern slavery training. When we broke down when we looked at modern slavery statements more closely, we could say that almost a majority, about 88% of local authorities, had some form of training, and these could be very basic training in the form of guidance on notice boards to more sophisticated training offered to staff in councils. But in general, the majority of these training were internal training, and only about, I would say, 40% offered some form of external training to their staff. In general, one key aspect of a training framework that requires to kind of improve understanding of modern slavery was collaboration with external actors, for example, collaboration between local councils and social organizations, other public services, and only 55% reported on such collaborations. Again, as I said earlier, the reporting on suppliers and contractors was in general very low. Similar findings resonated in our online surveys. Some additional information we could get out of our online surveys. For example, 57% of modern slavery leads stated that they received less than 2 hours of training annually, or 53% said that the current victim identification processes that they have in place, they were not fit for purpose. In general, I think uh, about 40%, only 40%, well, sorry, around about 40% stated that they were unprepared to act as first responders, and only 11% strongly agreed to be equipped to identify, deal with, and address modern slavery instances. So just to give you a graphic indication of what we found, in general, there was some form of training, but when it came to training key staff, um, the training was not as high as we expected. For example, council managers, only about 50% of them received training, or elected councillors, above 60% received some form of training. And when they asked about how confident are you in your training to act as first responders, about, I would say, 56 to 58% kind of agreed that they were confident, but the rest either did not say anything, or they disagreed or strongly disagreed. The, we kind of explored some of the key points further during our interviews. And what transpired in our interviews was that no one said that the training offered a comprehensive or consistent package to their staff. And almost everyone we spoke to stated that there was there were lots of resource issues and capacity issues. And of the 15 the councils we spoke to, only 5 had modern slavery roles and teams in place, and the rest were just council staff who just decided to take it upon themselves to help with modern slavery issues, and they came up with fantastic, innovative approaches to deal with modern slavery. So, in general, we got a feeling, and many of our participants, well, many of you guys stated that there is a need for mandatory national framework that provides some form of a standardized level of training, and to bring everyone more or less to the same level. This is despite the variation in the needs for modern slavery issues across different councils. One thing that we found fascinating was that some of the councils collaborated with each other, and they found the collaboration ever so helpful in terms of saving resources. In conclusion, I think we are ever so grateful to everyone who spoke to us. The level of commitment, the level of enthusiasm was truly inspiring, especially those who came up with fantastic ways of dealing with the situation. But the frank conversation kind of helped us see what had to be done and what was practically doable, especially in the absence of any training for some of their colleagues in local authorities. So I think we ran out of money half the way through this project, and it was the dedication of people we spoke to that kind of encouraged us to keep on going with this project, and we felt we had to finish it regardless. So I think what also happened was that when we looked at specific cases, only 11%. Sorry, if we can go to the final slide, Runa, I think you took over. Yeah. Only 11% of councillors felt confident to identify and respond to modern slavery, which kind of was very low percentage. And we felt that because most of the training we came across were on ad hoc basis, they were not continuous, they were not up to date. Many key aspects were missing. Many key roles did not have any mandatory training, And because of this general level of insufficient training for counselors, contractors, and managers, coupled with a range of other gaps that we could identify, we felt that there is a need for a training framework that goes beyond just ticking boxes. There is a need, the training framework should help a change of culture, a change, for example, for staff to have an understanding of what is meant by duty to notify, and also collaboration with other stakeholders. This we found evidence of fragmented multi-agency referrals, which kind of it has to be resolved or at least mitigated using a coherent training framework. So I hand over to Runa, who's going to discuss our preliminary training framework in more details. And thank you.
Yes, thank you, Sepideh. Thank you so much. Okay, yes, as my colleagues have said, obviously aligned with the aims and the results of the study, apparently there is need for a training framework, also because individual commitments is not enough. There are gaps between implementation, practical obstacles, and there's no mandatory standardized approach that can help reduce those gaps. So what we've developed is a preliminary training framework based on the findings of this study, which was a multi-phased, but obviously it was not a large randomized control trial, so it was mainly qualitative in its nature. Therefore, the numbers are not very high, but what we found is clearly indicating that it would be beneficial to start developing a standardized training framework for local authorities to better act as first responders. The framework, this preliminary framework is not only based on the study findings, but also it builds upon and aims to collating also with future collaboration, previous tools developed, which are nationally known and officially used, such as what you can see here, the survivor care standard, even the recently, just yesterday launched self-identification tool, and several other tools that the Human Trafficking Foundation have developed. Going into the framework in itself, which I hope you guys have had the chance to give a look at in order to better discuss to inform better discussions that are following. We've come up with a three-tiered preliminary training framework, which echoed also the Skill for Care's existing training framework. It works very well as an approach. The tier one is meant to provide basic awareness for all staff at all levels within the local authority. It is meant to be an e-learning, even if we know that doesn't always work, but it's to reduce costs. It could be very, very beneficial. Key topics or objectives, as you can see, is very elementary. It's about what modern slavery is, how to recognize first signs of exploitations, how to report a concern, and an overview of the Modern Slavery Act, as well as the NRM, which some study participants told us that not everybody within the council do know about. The second tier goes more into detail, and it's meant to be delivered to frontline staff and councillors and to be delivered face to face. This is meant to for councillors who work directly with the public, and to need the skills to more confidently recognize and act on concerns. So the topics and objectives, learning objectives are a bit deeper. So again, we want to provide people with tools to identify more complex or hidden forms of exploitation, a step-by-step NRM referral guidance, collaboration with police, NGOs, housing, social care, the NHS, and so on. Finally, the third tier, is to provide advanced training for specialist staff making an NRM referrals and who would take on the role of becoming MS leads within the local authorities. So there's to be training on advanced risk assessments, case management, long-term support for identified survivors, legal procedures as well, ability to strengthen accountability, internal reporting, and legislative readiness, but also to become trained trainers, so to start, ignite the loop of education, training, and good practice. The delivery of this, it will be in person, we believe, and peer learning also through case study review and discussion. So I think this is it for now. Obviously, the second half of this event is devoted to discuss in detail this preliminary training framework. So I will now pass it on to Ele and to our guest speaker today. So thank you very much.